Welcome back to the Nutrition Made Simple podcast. At Healthy Steps Nutrition, we believe something as fundamental as nutrition shouldn't be complicated, which is why we focus on a simple, habit-based approach. We know that helping you become the healthiest version of yourself isn't just about what you eat or spending a few hours a week at the gym. We have to look at a holistic approach, looking at stress management, mindset, lifestyle, support system, sleep, exercise, and of course, nutrition. I'm your host, Nicole Aucoin, registered dietitian and founder of Healthy Steps Nutrition, CrossFit HSN, and HSN Mentoring. I'm also the author of the Healthy Kids Cookbook, 100% kid-approved recipes. You can find it on Amazon. I'm also the author of The Basics of Nutrition Coaching, CrossFit Preferred Nutrition Course. In this podcast, I'm going to teach you how to take one step at a time to becoming the healthiest version of yourself. Well, I'm so excited to have Dr. Christina Migliara on today's podcast. She has her Ph.D. in psychology. She is a family and marriage counselor therapist. She also specializes in trauma. One of the really cool things about her is she actually owns a gym, a CrossFit gym in Florida, CrossFit Tailwinds. I first heard her speak at the Florida Affiliate Gathering in 2021 and then had her start doing some stuff for our coaches and gym owners in HSN Mentoring. In March, we actually hosted an amazing webinar on prioritizing mental health inside your CrossFit gym or boutique fitness facility. If you want to catch the recording to that, all you need to do is click the link in the show notes. In this podcast today, we're going to be talking about what is mental health, why it's important, what someone can do to help prioritize their mental health and get into a better mentally stable state if you are struggling, and when you should go seek out some professional help. Now, I think sometimes when we're struggling with mental health, we talk to the people that are familiar with us. And while we're talking things out, and that's great, we're not actually moving the needle forward as fast as we want. Well, I really hope that you enjoy this podcast all on mental health. I think Dr. Christina has an amazing message that more people need to hear. And now more than ever, we need to be prioritizing mental health. Enjoy. Christina Migliara, welcome to the Nutrition Made Simple podcast. I'm so excited to talk to you today all about mental health.
Hi, thanks for having me. I'm really excited. It's my favorite topic.
Well, you have a unique background because you are a CrossFit gym owner, but you also are a therapist. You have a pretty extensive practice, and then you guys do a ton of wellness in your gym, which is located in Jacksonville. Talk to me a little bit about how we incorporate all of those things to best help your community.
So that's a great question. We have taken this model for about almost 3 years now and found that that holistic model really is what works best for people. When I went into this, obviously I was coming out of it as a practitioner first, doing CrossFit as something that was for my mental health, just being an athlete and really enjoying that as part of my regimen for my exercise each day, just to kind of give myself a healthy outlet. I found that in my practice, for the longest time, I was outsourcing a lot of homework, if you will, to my clients to, make sure they were fitting in time for their self-care and creating those coping skills and healthy outlets that help them to feel their best selves. And then I felt like, you know what, I could do this and I could do this differently and I could bring this all together. So essentially, without going into that whole long story, we created this wellness center for a one-stop shop to meet all of the needs so that I essentially could send my clients right down, the hallway to get what they needed if they wanted to. It was an option and we wanted to make it readily accessible for people. And what we have found is that being able to do the physical and the mental pieces, each day is really what helps them to feel their best self. And then what I have found from a clinician standpoint is that being able to be a practitioner as well as an affiliate owner, there's a whole lot of skill set that I brought from mental health perspective into the gym that I've just seen create such amazing benefits for people. And they're just, not only seeing that physical transformation, but the psychological transformation has been incredible to watch.
It's so amazing to hear your story. Like you started as a practitioner and realized like, hey, my love of CrossFit and then combining these two together to really help people, become the healthiest versions of themselves physically, but also mentally is pretty incredible. And I've personally been to your facility. You guys hosted actually the CrossFit affiliate Florida gathering. So we got to come into your facility not that long ago, which was pretty amazing. I want to dive into the mental health side because, I think over the past year and a half, mental health has become a bigger topic. I think there's such a stigma about it pre-COVID. And now, I mean, you look at the statistics and there's a tsunami of mental health illness right now. Tell me what you're seeing in regards to the clients that you serve and the people that you work with in regards to mental health.
Sure. So let's first talk about like what mental health is. And it's interesting that it has such a stigma attached to it because when we say mental health, we usually think of like a lot of people associate that with mental illness. And that's just not true. I mean, your health is made up of your mental and your physical health. And that's just the way it is, right? So mental health includes our emotions, psychological and social well-being. It affects how we think, how we feel, how we act. I mean, it determines how we handle stress, how we relate to others, the choices that we make. It's part of every stage of life. It doesn't go away. It's not some interdependent, disconnected piece of us. Mental health is health. They just go hand in hand. So I think that one of the most important things is that people start to understand that you can't separate the two. And one really affects the other. And the way I like to think about mental health is, think of it as the driver, right? It's the driver of all things that we do. And if our mental health is good, if it's well, then we tend to make better choices. We tend to do things for ourselves that we know help us to be our best selves. But when we're not feeling, very good about ourselves, then it affects all of our choices. And then we tend to, shut down and isolate and things like that. And there's lots of ramifications then that come out of those choices that lead to the physical side of things, the medical side of things that you see manifest. So we really have to start thinking about mental health first. And I say that all the time. I'm like, I promise you, if you put your mental health first, the natural progression of that is everything else that you're looking to happen. All the goals you want to achieve, you will see it come to fruition. It will manifest itself if you can put your mental health first.
It's so interesting that you say that, right? Like, because it's true, your decisions that you make every single day, if you're in a good headspace, they're going to be better decisions than if you're not in a good headspace. And it's so interesting to look at when you look at the research of, okay, how mental health and exercise together really helps people see amazing results, become their best selves. Nutrition, sleep, like they all work together in this holistic framework to help people become the healthiest versions of themselves. And, before we started this podcast, I was looking up some research, right? Like, okay, what's going on pre-pandemic versus post-pandemic? And a lot of the research shows that mental illness, anxiety, depression is on the rise post-pandemic. And whether it was, okay, right during the pandemic or the long standing issues of like, oh my gosh, we just went through a lot of traumatic stuff over the past couple of years. Talk to me about what you're seeing in regards to increases in mental health illness.
Yeah, so we're seeing a lot of those symptoms, creep up as a result since post-pandemic. So if we go pre-pandemic, it's not that these things didn't exist, but what happens is that everybody is in different levels. So just to throw a couple of numbers out there, you've got about 61% of the population who has experienced a traumatic event in their lifetime. That is huge. That's a huge statistic, okay? It's like 1 in 6 that endure 4 or more traumatic events, from a childhood on. So think about the number of people that come into your gym and just think about those statistics right then and there. That means that you're kind of seeing that happen. I mean, that's a lot of people. So then you take, everyday people, you take people who are predisposed to things just because of genetics, such as alcoholism, depression, anxiety, other mental illnesses. You have people who have mental illness You have your, your common everyday person who maybe doesn't have a good set of coping skills, maybe doesn't have a lot of healthy habits, that they've formed, healthy outlets that they're participating in. They're overworking. Then you throw a pandemic at them and you say, okay, now deal with it, right? And here comes this life-altering traumatic event. Everyone has to think on the fly. We don't have a lot of information. We're trying to, come up with things as we go. We're looking to leaders to help lead. They're trying to figure things out. So there's a lot of chaos that goes involved with that pandemic. And it really took us on a wild ride for, a couple of years now. And we're still figuring some of these things out. So everybody's going to react differently. Those folks who have had a good solid foundation, who have really taken care of themselves, they have a high level of resiliency, that they're not necessarily going to feel major effects. It's more acute symptoms that we might see maybe a month or two, couple months post pandemic. And you have to remember that, across the globe, like, we're all in different stages. Some people are still coming out of lockdowns and shutdowns. So we're all on different timelines. So you figure that we're at least about 1 to 3 years is what they're predicting of some of this aftermath of psychological symptoms that we're going to see. And again, some of that might be acute for some of the higher functioning and more resilient people, but some of those who suffer from mental illness, who, lack the coping, who tend to struggle a little bit more, they suffer from anxiety and depression. You're going to see much higher rates of these statistics in reporting, feeling not very good about themselves, isolations, fear, social anxiety, unsure of what to do. And that affects their decision making. And that's a lot of what we're seeing. And that's a lot of what's been coming into my practice.
Makes complete sense. I mean, that's super interesting. 1 in 6 people will experience at least 4 traumatic events. I mean, that's a lot of traumatic things happening to quite a number of people in the population. That's pretty crazy. I was looking up some of the statistics, and I was talking about antidepressant use and how it's been on the rise in 2020. And it said that 11% of people, insured Americans, have at least one prescription for an antidepressant in 2020, which is essentially over doubled, almost tripled since 2019. A lot of people are going to medications, and which I completely understand that that's one way that some people need to cope. I want to talk about what are some of the other coping mechanisms that people can do? Like, let's say we've got a listener who's struggling with anxiety or depression. What are some things that they can do on their own to help them get in a better headspace? What are some popular things? So,
believe it or not, there's a lot of real simple things that you can do on the daily. And I talk to my clients about this all the time. They seem insignificant, and sometimes they even get some head turns like, that's it. But when I've asked them, upon return, how that made a difference in their week, they come back saying like, oh my gosh, that made such a huge difference. So a couple of quick things. One, making sure you're getting enough sleep. I work a lot with my clients on good sleep routines. We create good sleep hygiene, and we flesh out a nice routine in the evening to help wind down from the day. We are in an age of indulgence, and we're very much into working and hustling and grinding and being turned on all the time, whether it's from work or from our smartphones and devices. And we need to have this period of time where we can just decompress a little bit. So a good sleep routine is small things that you can do, disconnecting from your smartphone, and your other devices and TVs is a great, easy way to feel better and feel less anxious. Going outside and getting some fresh air, just a small walk, some vitamin D, sun's out, some fresh air can really, reset yourself, just to kind of bring down that hypervigilance that a lot of people are just feeling on the daily. I think we walk around very much like on edge these days, and we just need to recognize that and just drop our shoulders a little bit and just breathe. Some other things might be to exercise. If you can get out and get some exercise a little bit each day, whether you get to the gym or you go out for a run, movement is a huge healer. And it's probably my top recommendation to every client I have. I was like, you're made to move. You're not made to sit. You've got to get out. You've got to get fresh air. You've got to move your bodies. So those are probably my top three: sleep, fresh air, and exercise. I can go on, but I'd say top three.
I love it. It's interesting. I've shared pretty openly that I was struggling with some mental health issues, which I had never struggled with in the past. And one of the things that made it exponentially worse is I couldn't sleep. Like I literally was up all night, and I know the tricks to get sleep. I could not fall asleep. And I think these things do come in combination. I started exercising again, and then, okay, now I'm more tired and I'm able to sleep. So, when you're exercising regularly, your sleep routine is inevitably going to start getting better as well, because your body's just going to be a little bit more tired. I think we live in a society, and I know I struggled with this quite a bit. Like we want instant results, right? So we are struggling with some issues. There's a lot of people struggling with mental health and illness, and we think, okay, I'm going to start doing this sleep routine, and I'm going to exercise. I'm going to do exactly what you said. And all right, tomorrow I should be better. Unfortunately, I remember talking to I had actually two mental health therapists that I worked with. And I still work with one of them, but I was like, all right, just tell me what to do. Like, just tell me what I need to do to get better. Like, let's make it happen. Like, I will put in the work. I want to get better. And unfortunately, time is essentially what it really took, which is not what anyone wants to hear. Talk to me about the process people go through when they get professional help. Like it doesn't just like magically get fixed overnight. But talk to me about the process of when you are deciding like, okay, I really need to get help. These three things, getting outside, exercise, a sleep routine are not helping me get better. I need some professional help. What is the process typically that people go through?
Sure. Yeah, it definitely goes beyond that. So the first thing is it's really important that you find the right mental health professional for you and that you connect with them. So you can get lost in a sea of credentials out there, not understanding what they are. I have a bajillion letters after my name, and nobody, unless you're a mental health professional, would necessarily know what they mean. So you want to be able to dissect that and understand what that means. It's usually spelled out, on people's websites and in their bios and things like that. So being able to find, one, the person who specializes in the nature of the concerns that you have, and two, that you feel that you've got a connection with and that you feel like it's a good fit. Because if you don't feel like it's a good fit, you're not going to be willing and wanting to open up. And if you can't connect, then it's going to be hard for that professional to be able to really help you and for you to be in a position to receive that information. So that's like numero uno. Find the person you feel is a good fit. And fortunately, there's plenty of us out there. Unfortunately, not everybody is the best at what they do. Every profession has it. So you've got to do your homework and don't be worried about shopping around. Once you find that, you might come into that first session, and if it's done well, you're probably going to walk away feeling a little bit better just from the sheer fact that you can talk about it. Just being able to unpack some things and finding someone that's safe to talk to about those things that have been on your mind, maybe for years, and unpack that a little bit is so relieving to people. I mean, I just watch their whole body language change in my office sometimes, and, they're feeling so relieved, and it's wonderful to see. And my job is to reassure them that this is what this is for. This is a safe place, and we're here for, to help you. And so you might have some instant relief, but understanding that it is a process, like you said, you're going to have the different moments where you're feeling really good about things and you're feeling really positive and you're seeing some momentum, but you may have some regression. You may have some bumps in the roads and barriers, especially if you have some, traumatic past or anything more in depth that needs to be unpacked that maybe you've been compartmentalizing and holding on for, I don't know, years. It just depends on the nature of the issue. So there's no real timeline as to say how quickly or how long it's going to take, but we want to get out of the mindset of the instant gratification because there are no quick fixes. You mentioned the statistic on the medication, and I am not anti-medication by any means. There are people who need it, and that is totally fine. But there's no magic pill, and that pill might make you feel relieved instantly, but it's not the one and only thing. So we want to make sure that we're thinking of this on a continuum, and we're thinking multiple tools for the tool belt, not just one tool. So medication is one tool, but if you accompany medication with a lot of other things that we're talking about here, such as talk therapy, such as exercise, such as sleep, nutrition, and all those other pieces, and you've got like 5, to 10 different things that you're incorporating into your plan, your treatment plan, then that person's most likely going to be much more successful and see results much quicker than somebody who's only doing one thing. And so that is really important, I think, to explain to people. I work a lot with psychiatrists and psychiatric nurse practitioners, and we're a team. They do one thing and I do a different thing, but collectively is what helps our clients to be their best selves, not one of us.
I think that's so valuable to talk about. I think this is one piece of the puzzle, but I also think that seeking professional help and asking for help is something that a lot of people might be embarrassed to say, like, okay, I need some help. And I think too, when people are struggling, and I can say this from personal experience, like I didn't want to tell anyone, right? Like you kind of like seclude yourself when in reality, like you need people, you need community, you need support. So I would love to just kind of talk about, when should people seek professional help versus chatting with their spouse, coworker, family members about the struggles that they have? Because there's a different course of action when you seek a professional versus you talk to your spouse every day about the struggles you're having and why you're feeling the way you're feeling, right?
Sure. And look, like your friends, your friends and your spouse, those are your part of your support network. You don't want to not necessarily talk to them. You want them, they're part of the process. But what differentiates them from someone who is a professional like myself is that we are trained specifically, and it's our job to essentially empower you and to teach you and to guide you. And your support network is not necessarily going to have that set of skills. It's a different type of support and help. So what I really would love to, get people out of this archaic view, which is we seek help when we're in crisis mode, right? So you're asking when to seek help. The truth is that if you feel like you're going through something, some kind of life change at some point, whether it's, a traumatic event, or it's as simple as just some kind of everyday change, and you just want to talk about that, you want some support through that, and maybe some professional, take on it, there is no right or wrong time to get help. Yeah, certainly we don't want people spiraling into crisis mode. We want those people to definitely get help. But I'm very much of the preventative mindset. And I tell my clients all the time, like once we get them to where they need to be, we call that the maintenance phase. And we do maintenance check-ins. So if they're like, hey, I want to come see you in like a month, I feel really good, can I do that? I'm like, absolutely. We'll check in, see how you're doing. That reassurance, just making sure I'm on the right path, helps us to keep out of that crisis mode. We don't want people redlining into crisis every time they get to help. It's a lot harder to pull people out of that. But we do want to empower them so that they can be able to do it on their own as well. So I think it's fine if you're going to come in for crisis mode. Yeah, we definitely want to help you, but we also want to normalize the importance of mental health being a tool at a lot of different stages, not just when things are bad.
I think that's so important. And I think that was a mind shift that I personally had to go through, right? Like, okay, you go seek someone when you're in help. And then it's like, actually, wait a second. I really enjoy talking to the person that I work with. Like, I feel better after talking to her. And it's nice to have that maintenance, that reassurance, and that ongoing support, which I don't know that a lot of people have, especially when we look at, high-level business owners or people that are working from home that might not have as much connection. Like, we were meant to do life together. And, some of our listeners are definitely, members of CrossFit gyms or boutique fitness facilities. They have that community of people, but some people might not have that community. And just having someone else to talk to, a professional, is so important in all aspects of becoming your best self.
Yeah, absolutely. Socialization, community, that's important. It's a necessity. So, I mean, when I have people come in here and they're like, hey, I just feel very isolated and lonely, I'm like, go join a CrossFit gym. Go join a CrossFit gym. The days of meeting people at bars, like that's just not a healthy avenue. If you want to make friends, if you want to get a good exercise routine, you want real results, you want the whole package, just go join a CrossFit gym. And you see their whole lives kind of change around. I mean, it really is essentially that is like a one-stop shop for a lot of the maintenance needs that a lot of my clients really need. So I love being able to showcase that. And I'll take people out if they want, just to see and observe and watch it unfold in front of them. And they're like, wow, that's so great. Look at this. And, look at so-and-so's cheering them on. And wow, that coach is actually paying attention and giving support. We're like, yeah, that's what a gym should be doing.
Yep, exactly.
And they love it. So, it's a fine line between, having that person as the therapist to go to, and then being able to do it on your own in terms of support. I'm not of the mindset that I want to be the person where you become dependent upon me to feel good. I never want to create dependence. So that's what I'm very anti. I'm in a helping profession, and my job is to help you. It's not for you to become dependent upon me. So I love to empower people to be their best selves and to figure it out on their own. I'm not an advice giver. I'm a guide, if anything, but I'm going to help you figure that out, and you're going to do it. Because if I'm always doing it for you, if I'm always giving it to you, then how are you going to survive this world? How are you going to do it? That's not what this is about. So I'm going to empower you. I want you to feel the confidence. I want you to feel, the ability and the self-esteem and all the things that go into living your best life, whatever that looks like for you. I'm not here to tell you how to do that in terms of like, oh, you should do this, you should do that. You should do what you think you want to do. So long as you're not causing harm, to the world, I really don't care. I mean, I don't. The world's your oyster. Go be the best plumber, gymnast, whatever it is that you want to do. I want to see what that looks like for you. And the only way for me to do that is to empower you and help you to do it for yourself. So therapy is a tool. It's not a place that you rely upon it forever, but we're here when you need us.
I love it. All right. So as we wrap up this podcast, I would love we're going to end it with two different things, which is unnormal, but that's okay. All right. Someone who is not currently struggling with any mental health illness, what is one thing that they can do to prevent them? At some point, you likely will struggle, but what is one tool that they can do to help them prevent the struggle?
So if you're not struggling to that level, then you must be doing something right? So keep doing what you're doing, basically being tuned in, tapped in, connected to who you are, and being very mindful about what you're doing and how things affect you, right? You got to trust your intuition. When something doesn't feel right, being able to acknowledge that and respond to that accordingly is really important. There's a lot of intuition there that goes along with that mindfulness and saying, oh, well, that didn't feel so good. That person's toxic. Let me remove myself from the situation. So, understanding the people you're around, the environments that you work in, your healthy outlets, making sure that you're doing your day-to-day maintenance to keep yourself in that position. That's what's going to keep you thriving. And if you feel that you could use a little bit of a boost, or you're starting to hit that, being able to seek out some help, before you get to that red line.
What are some signs that you should start seeking out help?
If you find yourself isolating a lot, not wanting to do your daily activities, not wanting to be around people, basically, shutting down. Shutdown behavior is a classic one. If you feel yourself anxious a lot, even in normal settings where you wouldn't find yourself feeling that way, but you're all of a sudden finding that you are in social situations or even at home, that would probably be a good time. Any thoughts of self-harm or any feelings of hopelessness and helplessness. Obviously, if you're feeling thoughts of imminent danger and self-harm, you want to do something immediately. You don't want to necessarily wait to get in with a therapy appointment, but rather, bring yourself to an ER or call a crisis hotline, things like that, and then get yourself an appointment with a professional as soon as you can.
I love it. And then for people who are struggling, you talked earlier about getting a good sleep routine, going outside, getting exercise regularly. What is one step for those people who are struggling that they could take? Would you go back to those three things, or hey, start reaching out and ask for help from a professional?
Yeah. So those people, that's the hardest part, because once you get stuck in that negative feedback loop, it's really hard to pull yourself out of it to do the thing, And here's the thing, like, most people know that they need to do these things. They just find it really hard to do it. And so those people, I would say, look, you're not alone. We're all going through something. To some degree, everybody could use it. And, it's really just kind of fighting that initial struggle of, I know I don't feel good. I know this is hard, and I know I don't want to do it, but I need to push myself to do it, and just doing it. Because once you get there, you realize that this was the best decision you ever made. So it's just getting there. It's kind of like the gym, right? We know if we get there, we will be good after, and we love it after the fact. And we're like, oh my God, I'm so glad I came. But getting there was the hardest part, which is why it's so important that we as professionals are ready, willing, and able to welcome that. Because for some people, that is the hardest decision. And if you don't, catch that and empower that and help people to feel safe and calm that, they're going to turn away. They're going to go back and say, see, why did I even bother? And that could be the difference in whether or not they actually get help or not. And just be kind to each other. I mean, gosh, that's a biggie.
I feel like we're in such a hostile environment. Like, if you don't agree with people around you, like, you're just, you're the worst person ever. And we're just such a hostile environment right now. All right. Well, thank you for all of these tips. I think this is going to help so many people just understand, hey, you aren't alone. You can do these things on your own, but it is also totally okay to ask for help. There are so many amazing therapists out there that are willing, able, and want to help you become the best version of yourself. Where can people find more information about you? We will also put, some links in the show notes, but if someone's listening and they want to find more information about you, where can they find you?
So I'm on the social medias. My company actually just rebranded. It's called TheraFit. So you can find me on Instagram at TheraFit_works. And on Facebook, we have a website at therafitworks.com, and then CrossFit Tailwinds.com as well.
Awesome. Thank you again so much for coming on. I look forward to working with you more in the future.
Thank you. Thanks for having me.
I hope you enjoyed that episode on mental health. There are so many things that you can do. And there's such a clear association between exercise and my mental health, decreasing anxiety and depression. Actually, research shows that exercise can decrease anxiety and depression by over 30%. That's more effective than most antidepressant drugs. Think about that for a second. By you moving, getting outside, or just getting some exercise in, you can actually help yourself get in a better mental state. I want to talk about one other thing. Actually, the best Audible book that I've ever listened to. I listened to it most recently. It's called Soundtracks by Jon Acuff. He's a comedian, motivational speaker, author, such a funny guy. He actually says the book out loud if you get it on Audible. But it talked a lot about overthinking. And I think sometimes when we're struggling mentally with mindset, overthinking can cause some problems. And in this book, it talked about how you can stop overthinking and really take control of your mindset and help improve your mental health. So highly recommend listening to that book. Now, at the end of the day, the thoughts that we tell ourselves regularly is what we start believing. So are you kind to yourself? Are you giving yourself a little bit of grace? I think some people are harder than themselves on others, but one of the interesting things that he talked about in this book was, what are you actually saying to yourself? And he challenged everyone to do this 30-day mindset challenge. Stand in front of the mirror and tell yourself positive affirmations at the beginning and at the end of every day. I'm not going to give you too many spoiler alerts, but in the book, he talks about after having 10,000 people do this, the massive increases in people achieving success and not overthinking as much was literally mind-blowing. So highly recommend that you check out that book. Again, it's Soundtracks by Jon Acuff. I will get it on Audible. He reads it and he's quite funny. All right. Hope you enjoyed this podcast episode. Make sure that you subscribe. I would also love for you to leave us a review so that this podcast can be found by more people. We'll see you back here next week.